David Zahalik, and I've got some information for you about the difference between sinusitis, strep throat, and the flu. Of course, it's January now, so all of those things are potentially going to affect you or your family. So I thought it might be helpful if you had an idea of how they present symptomatically, what the differences are. And the intention is not to make you somebody who has to diagnose themselves, but sometimes information goes a long way in knowing when to seek care. So we are seeing the most right now of those things of sinusitis, probably driven by the fact that it was a late ragweed season and the will always feed and push sinus infections. Now, the type of symptoms you get related to a sinus infection
are more related to which sinuses are involved. Like, for example, you've got frontal sinuses here above your eyes. And if that's involved, you might get a real bad headache associated with some nasal discharge and a fever. Or if it's your maxillary sinuses here, you may feel like you have a toothache with or without fever, drainage, nasal discharge. If it's your ethmoid sinuses, which run right next to the nasal cavities, it'll feel like a cold that just won't go away. So lots of green mucus, congestion, and then this tendency to just not get better over time. Generally speaking, if you have those symptoms for more than 10 days, you're probably looking at a sinusitis more than a cold. That's not 100% diagnostic, just kind of a rule of thumb. And then there's the sphenoid sinuses that are deeper, and that'll give you kind of like an ice cream headache kind of pain, again, along with perhaps fever and congestion. But it could be any of these symptoms or a combination thereof. So that's a little bit about sinusitis. Of course, we treat it with uh, antibiotics and then something to open up the drainage, the pathways for drainage of the sinuses. But it's different from strep throat. Strep throat is they call it strep because it's a bacterial infection with a streptococcus bacteria in the throat and tonsils. And often when we look at the throat, it's very, very red. They say sometimes fire engine red. The other thing that's very diagnostic for that is you'll sometimes see little red dots in the back of the throat over that thing that hangs down the uvula. Those are called soft palate petechiae, and they're highly specific for strep. A lot of people say, well, I've got white patches on my tonsils. That doesn't necessarily mean strep. It could, or it could mean viral. So that's not as reliable. The three most common symptoms if you have strep throat are sore throat, headache, and a fever. And if you get those all of a sudden and the sore throat is severe and the fever is higher, it makes strep throat more likely. We use most offices use a in-office test, which comes back in a matter of minutes that'll tell us if you have group A strep. And that's the kind of strep that is associated with other problems after the fact. So again, if you have those symptoms, it's probably a good idea to get tested for that. Now, influenza or the flu, we haven't seen as much of. It's been a pretty light flu season. Bear in mind, though, that the flu season is heaviest in February. That's the worst month typically. And then January is the second worst month for severity of it. But nationwide and locally here, we just haven't seen very much. Doesn't mean it won't come, but so far so good. Influenza shows as a sudden onset of really kind of systemic symptoms. So you usually get severe achiness and a high fever all at once. You might well get a headache, nasal congestion, sore throat. Usually you'll get a sore throat with real big tonsils, and sometimes it's not very red. It's a very benign looking sore throat that's severe and big tonsils. Like strep, we can do an in-office test in a few minutes. We just swab your nose, and then we can find out if it's the influenza germ or not. And that's significant because we use antiviral antibiotics to treat influenza, which is different from the antibiotics that we treat other bacterial infections for. So, not to make you into a situation where you have to diagnose yourself, but this information might be helpful for what your symptoms mean and when to seek care. Hope that helps. Take care.